how to get the most out of your ketamine treatment. Whether you're doing Spravato, S-ketamine, IM ketamine, IV ketamine, I really want you to watch this whole video on how to get the most out of your treatment. I'm Dr. B, Christy Bundakumara, psychiatric nurse practitioner with over 20 years of clinical experience, and I own the Mentally Strong Clinic in Colorado Springs, where we do ketamine and S-ketamine. We have been doing ketamine and S-ketamine for about 3 years. And I have learned so much in this process, and new research and clinical experience has been really coming out around S-ketamine and ketamine because more clinics are doing it. If you're not in Colorado Springs, Google search, there's probably a ketamine clinic in your town. But I want you to understand what it is, whether it's safe. There's another video on is ketamine safe. I want you to watch that one. But also I want you to go in with an intent. I want this to be therapeutic for you. There is a strong neurobiology process that is happening with ketamine. Lots of research is being done about this. We know what receptor it's targeting. We know that it's helping with depression, and really even with severe depression, like depression with suicidality. So we know that there's a strong neurobiology component. But after 3 years of doing this in a very medical mindset at our clinic, I want to challenge you. I want to challenge you to also make this therapeutic. Okay. I have a video on it's, to be informed on this process, but I also want you to have insight. I shared a story before of someone who had never really processed any of their feelings, and they had their first ketamine treatment, and it just all came up and he couldn't handle it. Just think of opening Pandora's box and not knowing what to do with it. And I'm going to talk about the Mentally Strong method because this is a solid cognitive behavioral thing that you can learn. And it's about organizing those things, right? How many of you out there actually feel like you don't have your brain organized? I would say 90% of my clients, when they come in the door, they would say that they do not have their brain organized. And so I think it's important that you get this skill of organization before you go into ketamine. We have several clients now receiving ketamine. Some of them are on maintenance. They've been on it for a while. But we didn't do this process. But a lot of them had tried therapy and they, were unsuccessful there. So they are strongly benefiting from the neurobiology component of ketamine treatment. But we missed an opportunity. We missed an opportunity for it to be therapeutic. So what I want you to do when you come in for your ketamine treatments, I want you to come, I don't care if you've been doing it for 3 years or if you're starting today. I want you to come in to your treatment with an intent. I want you to start a journal today. I want you to start a journal and I want you to come in with an intent. What is today's date and what is my intent today? Okay. Some people disassociate so much they can't do anything while they are actually experiencing the ketamine. However, as it starts to wear off, you can write, what you experienced, what you were able to release. We're going to have some choice opportunities available. But how do you do that? How do you come in with an intent? So we don't talk about this a lot in mental health, but there are people who are really starting to teach and talk about mindfulness. And that's what I'm talking about. Coming in with an intent, being mindful of what is about to happen and how you can benefit from that. So coming in with an intent, some people have never even heard that. If you've done yoga, if you have any kind of meditation practice, any kind of prayer practice, you should understand this concept of coming in with an intent. Every time I do yoga, the instructor in the beginning, when we're warming up, will say, okay, verbalize your intent today. Tell yourself, what do you want to get out of this? Do you want to feel more confidence? Do you want to release something, right? And she'll go through and give, some possible ideas. She may even share, her meditation this morning and what she learned from that. And I really learned a lot from my yoga practice of being able to kind of come in with an intent and actually process that and remove it from the body. Same with meditation. I have so many clients that tell me I can't meditate, and I'm a thinker. Like my brain, anybody that knows me knows my brain does not stop. So how did I learn to meditate? I actually learned a type of meditation called Yoga Nidra, which is a active meditation, and that's intent, right? What do I want to get? And it's not all about getting and receiving, but what do I want to happen in this? And sometimes I pray about it. I do have a relationship with God, and many times I feel like God instills that intent on me before my meditation or before my yoga. But I can give you a very specific example. A couple months after my daughter died, Maya died December 14th, 2021. And a couple months after she died, I was invited to a sweat lodge, very specifically around grief. And if you don't know what a sweat lodge is a Native American, Lakota Native American tradition of a spiritual ritual of release and connection to the Creator. And I had never experienced this. I'm not Native American, but I was invited and felt that I should do this. Like this, this was something that I should experience. And so you're supposed to, make sure you hydrate and make sure you spend the day in prayer and meditation and prepare and have an intent going in to this sweat lodge, because the Creator wants to give and wants to connect with you. And so, you can imagine it's a couple months after my daughter passes that it's intense, and I was so angry. I deal with anger on and off about that, but this was like this intense anger, and anger at God, and anger at how could this happen again. And so I overwhelmingly went into this sweat lodge with the intent of releasing anger. And the process was a very spiritual, comforting, connecting process. So I'm glad I did it, right? That's what these ketamine treatments could be for you as well, because it is putting you in a space to connect spiritually. It's putting you in a place to disconnect or release the things that are holding you back. So I want you to think about what is intent and how can you come in to your ketamine treatment with an intent. Everyone's going to be different. Everyone is at a different place mentally, emotionally, spiritually. This is your journey. But I want you to not only benefit from the neurobiology that is happening during a ketamine treatment, but also the therapeutic benefit of this disassociation. So how do you do that? How do you have insight? So if you don't know me, haven't been through the Mentally Strong Method, I strongly encourage you to take the Healing Through the Mentally Strong Method course. It's an all-day course. It's 8 hours, but I promise you, you will not regret it. And basically, this course starts off with learning how to think. And we think we know how to think, right? We think all the time. The problem is our thinking, right? But in the Mentally Strong Method, it's a thought map, and we are trying to bring insight and connection to those thoughts. But we don't want you to stay there too long. Then we begin to teach you how to identify and organize. And I think this is missing in a lot of therapeutic interventions, is that we're not teaching organization. And so we're trying all of these techniques that we learn, which are great techniques, but they don't always do something for every category. And I can give you, meditation, for example. Meditation and prayer for me, it helps with my spiritual conflict and my anger at God, but it doesn't actually take away the pain of grief, which if you're trying to make it take away the pain of grief, you're just going to get more angry at God. Grief has to be, you have to have this time to process and feel that pain. And you could choose to take one of your ketamine treatments to actually do some controlled grief. Controlled grief is bringing in pictures, memorabilia, things that remind you of what you've lost, and allow yourself to cry. Allow yourself to experience that. And so in the Mentally Strong Method, we teach you how to think in a constructed manner. Then we teach you how to organize it. And then when you make those choices, because we all know we need to make better choices. Have you ever heard somebody say, you can just choose to be happy, and you want to tell them off, right? You're like, I can't choose to be happy. Well, there could be a neurobiology process. And if you are trying your hardest and you cannot choose to be happy, please let us put you on some medications, try ketamine, whatever. Let's do something for that neurobiology process. But at some point, you will be able to choose happiness. And choosing those moments of happiness, it's not a constant state of being. But if we can put these things in different categories and we know where things go and what to do for them, you can come in to your ketamine treatment with a very specific intent. So you don't have to know the Mentally Strong Method to receive ketamine treatment. I do think it would be significantly beneficial, but you can just kind of go in those choice opportunities, and you can, we will have some of those choice opportunities available, ones that are kind of appropriate, even maybe some of the kids' ones, because you are disassociating. Remember, we don't want to expect too much from our brains, right? That's why we want to go in these sessions with an actual intent. That we're not trying to figure things out. We're not just thinking and ruminating, right? Ruminating is when you are thinking into the negative. You just keep thinking, and you're not actually moving forward. How many of you feel like that? How many of you feel like, you've experienced grief or trauma or, all of these things that are contributing to your depression, and you just can't stop thinking? We want to teach you how to move forward. So eventually, I really want you to know the Mentally Strong Method. But you can just come into your sessions with an intent of what you want to do, okay? And again, whether you've been doing this for 3 years or you're starting today, I want you to understand. I want you to learn how to develop a personal vision for your happiness and then be able to adjust. I mean, if I'm the poster child for having to be able to adjust. I've lost 3 children. And this last one was like completely unexpected. The first one was completely unexpected. And so, you can have a personal vision, but you have to be able to adjust and be in this therapeutic process. So, ketamine treatment is twofold here at Mentally Strong. We want you to get the neurobiology benefit of the ketamine. And then we also want you to get the therapeutic benefit of the disassociation. So talk to the nurse, talk to one of the providers, get in counseling, take the course, get the full benefit of what is occurring, and come into your treatment with an intent. Because I know that you are mentally strong, but you have to find it inside of yourself. I had to find it in me. I was depressed long before I had a reason to be depressed. And I tell you, I understand. But I can't give you that mental strength. You have to find it. And whether we do that with, medication, neurobiology, ketamine, but also this therapeutic process of owning that strength for yourself. So I hope to see you in the clinic, and I'd love for you to share what your intent is for your treatment and share where you're finding your mental strength. You are mentally strong. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.